Hi everyone, we are live now with delay, at least 40 minutes delay. I had some technology problems, but I got them sorted out. So I'm here with Bilal today to just have a little chat about the OSCE exam. So hi Bilal, thank you for accepting the invite to do this.
Thank you so much to invite me.
Okay. Actually, I should say thank you for offering to do it because I didn't send the invite. It was actually Bilal that wanted to do this to help his fellow pharmacist. He's a pharmacist himself. He went through the OSCE exam. He went through the whole process. Just needs to get the visa sorted, and he will be on his way to Ireland. Uh, and actually, he was the one that wanted to do a Q&A about the OSCE exam because a lot of you in the WhatsApp group have questions about it, and I think it would shed some light on the process. So from here on, I will stop talking, and I will let Bilal do all the talking because I know very little about the TCQR, and he knows a lot more than I do. So, Bilal, if you want to walk them through the whole process step by step, please do.
Yeah, sure. Thank you for giving me the time and invite me. So I'm always here to assist anyone if I can do. As you know that the TCQR, the third country qualification recognition route is for non-European pharmacists. So have go to through different stages, like first the document evaluation stage, which we previously discussed already. Then the second stage, after getting the documents evaluated, you will get some response from the PSI, and you have to send another form. They will provide you with time to sit in the equivalence examination. So after getting a placement in the equivalence examination, the next task is to sit and get past that equivalence examination. So equivalence examinations have two stages. One is the written one, and the other one is the OSCE, which is a written OSCE and a verbal OSCE. So first part is the written MCQ. You have to do, no issue with that. The other part is the written OSCE. So there will be two OSCEs, and you have to attempt both of those written OSCEs in a fixed time duration. There will be 7 minutes for one OSCE, and you have to attempt one OSCE's question. There will be 3 or 4 questions. So though they will give you the guidelines and the helping materials with that. So after those written two OSCE stations, you have to go through simulated OSCE scenarios. There will be 7 verbal OSCEs. So for one OSCE stations, you will get 7 minutes, and you have to go through the complete setup of the OSCE stations. It will be a simulated medium, like you will get a simulated patient. There will be the examiner, but you will not be able to see the examiner. Initially, he will introduce you, but after that, he will be hidden, and you and the simulated patient, you have to go through for all the 7 minutes. And in those 7 minutes, you have to deal that simulated patient. You will be acting like a pharmacist. Guidelines will be given to you at the start of the OSCE. You will get some time, at least 1 minute, to read those guidelines, and after that you have to start from A to Z. But in OSCE, you have to follow a set pattern. So everyone who will follow a pattern will perform good. So if your performance is good in both OSCEs, the written and verbal one, I think you can get the minimum of the adaptation periods. So OSCE performance is really very much in the Irish equivalence examination. It's same as in other countries equivalence examination, but it's a practice base. So you have to do practice as much as you can do. I have some points to tell everyone to follow in this verbal OSCE examination. So, for example, the PSI in the exam will give you a scenario that you are working as a community pharmacist in a pharmacy at any city. There will be name mentioned, the day will be mentioned, and time will be mentioned. So you have to note these things, and you have to act like that. So if there is mentioned that you are a hospital pharmacist or community pharmacist or anything else. So you have to introduce yourself at the start of OSCE to the patient that I am the, for example, the community pharmacist on duty, your name, and I'm here to help you. So the introduction will be according to the given statement which the PSI give you at the start of any OSCE station. So be careful in that, follow the directions, and in initial 1 minute when you have to read all these things, you should get familiar with your role. Next, there will be the simulated patient. So you have to start dealing with the simulated patient. So first of all, you have to introduce yourself with the patient, and after that you have to say some fixed sentences to the simulated patient. For example, there will be a confidentiality statement, so there will be an introduction, there should be a consent from the patient if you want to ask any questions. After that you can follow some mnemonics with whatever you want to do, like fixed questions: what's the symptoms, since how long the symptoms, so duration, any other disease, any past history, any medication, any OTC or herbal medications, any drink, alcohol, or any smoking, pregnancy, breastfeeding. Like all these are set pattern you have to follow in every type of OSCE. So then you have to consult your reference source. If it is given initially, then you should and you have to consult your reference source. So after consulting your reference source, you have to get back to the patient and you have to guide the patient about the indications, about the medication, its duration, its effects, its adverse effects, its any possible allergies or other things if possibility is there. Then you have to get the understanding of the patient, that patient is understanding or not. You are giving the advice, if patient is not understanding, then the performance is not good. So you have to get the understanding of the patient also by questioning to the patient. Then at the end you have to do the follow-ups. So I will go step by step through all these stages. Initially, first you have to introduce yourself. So there will be a statement, PSI will give you 1 minute is there to read that. So when you read that, you will be entered in a separate room. There will be you and a simulated patient. So you will start with the introduction, which is given in the initial statement. For example, I am the community pharmacist. I am here to help you. How I can help you? So after that, you can ask the patient about his her name or what you wanna call her. Like, is it okay if I call you like if I is it okay if I call you Soren? So then you can go. Can you please describe me with your situation, with your present illness, with your present complaint? So these are the initial steps, and then after getting the initial statement from the patient, you have to say a confidentiality statement. So there is a marks for the this statement. So like anything we will discuss here will be the private and confidential. So you have to give the statement to the patient, and after that if you want to ask few questions from the patient, you have to take consent. Like can I ask you few questions in order to get completely understanding about your present situation and about your getting the previous history. So if get you are able to get the consent, then you can start getting through the patient's history or present complaint. Here you can follow any mnemonics if you have. I will advise you to follow any set pattern that will be okay for you, that will be good for your performance for all the 7 OSCEs, because all the 7 OSCEs will be similar. Little bit will be their difference. That I will tell you later that how they will cover 7 OSCEs in different topics. So like here you have to follow a mnemonic. For example, you can ask the patient initial questions like your age, present symptoms, past illness, past medication history, past allergic history. So you have to ask must these questions. And if any specific direction is given in the initial statement that patient have the allergy or anything else, that you must follow. Do not let it go. It will be harmful for you otherwise. After that, you can ask about the any herbal or OTC medication if taking, any pregnancy, exercise, breastfeeding, or alcohol intake. So if there is allergy, you should ask more questions about that kind of allergy, a true allergy, or what type of allergy, and what was the remedy for that allergy when it happened in past. So after getting all the necessary questions, when you are done, you feel that it's okay. So then next stage is the reference stage. You have to check your reference. There will be a BNF book or other supplementary leaflet they provide you. The PSI will provide you. You can download at the start of the OSCE station. So then here, statement for the reference check, you can put it there. For example, like I will say, thank you for giving the information. In order to provide you the best advice, I need to check my reference here. This statement you can adjust accordingly. Better you write. I will advise you to write whole OSCE station, listen these words and write in your own words. So because when you will write daily, your performance will be better. And then speak with someone else. If you practice with someone else, with simulated patient, like we two are doing, so I will say the Soren is a simulated patient for me. So do practice as much as you can do. Next, after checking the reference, so you should say thanks to the patient for the wait if you are spending some time in checking the reference source. So thanks the patient and then provide the complete information to the patient, starting with this, that as you had already told me that you are suffering from that disease which is already you familiar, which you asked him about in the mnemonic form, that as you are suffering from this for these days, which here you should repeat the information which patient provides you, because it will show the examiner that you all know all the information which patient provides you, and you have understanding of the patient condition. If you are going without this practice, it will be not good, because it may sounds like that you are not understanding the whole situation of the patient. So if you will repeat that, the information which the patient gives you, it will give a good sign. So after repeating those words, you can give the advice to the patient, or you can refer the patient to any specialty, like to any doctor or any hospital. So you have to give the information to the patient. If there is antibiotics, so you have to describe that to the patient that you have to take this medication for how long, for how many days, and at what time you have to take, and what effects it will do for you. So after that, you should ask the patient, so is anything else you want to know? So to get understanding of the patient about the medication or the problem. So after that, you should tell the patient about that beside the therapeutic effects, there are some other effects which are not required effects. So like the adverse effects or the side effects, you should tell these to the patients also, that you may feel some effects like the hives all over the body, like allergic reactions, anything which the like that medication could do to the patients. So you have to tell all those to the patients also. And after that, you should also ask the question anything else if you want to know. So after that, you can give some non-pharmacological guidance to the patient also, because if a constipation patient is there, so you can advise him or her for about the lifestyle changes, to take the dietary fibers, to take plenty of fluids. For example, if a dry cough patient is there, you can advise to chew candy or gum, but be careful if there is a diabetic patient or non-diabetic. So these all up to your understanding, but you have to give some non-pharmacological guidance also. So after that, also again you have to ask the about the patient understanding. So after following all these steps, if you are done, then the last step will be the follow-up. You can if you feel like You can give your contact number, or you can ask from the patient that is it okay if if I call you in couple of days just to check how are you doing with the things, or how the things are going with you. So that's all in 7 minutes you have to follow for a single verbal OSCE station. There will be total seven verbal OSCE stations. In one from one to second verbal station, you will get some time, like 10 to 20 minutes. You may get rest. You can recall your memories, or you can note down the previous questions, or you can do anything. But you will be online. Your web cameras will be online all the time. You cannot shut them off, or you cannot go outside the room. The seven OSCE questions, there may be a doctor session. For example, the doctor want to get some information from you. He's not in his workplace. He is outside, but he want to get some information. So he may call you, the one on OSCE station. Second, there may be some emergency medication supply you have to supply. For example, the patient may be there, and he cannot go to his physician, and he wants some emergency medications for a couple of days, 3 4 days, 5 days, or more than that. So you have to go as by laws in this kind of scenarios also. There may be some angry patients also. So there may be a mistake from that by the technicians or the assistants or the pharmacist also. So you have to deal that kind of scenario also. The situation will be given, but you have to follow the same pattern. You have to ask all the questions. You have to follow, if required, the reference, and then you have to give advice, then to take patient understanding, and then do follow up. So this the third one. And fourth one will be about some OTC medication, or some advice, like anyone can come for help regarding losing his constipation problem. So that could be the non-pharmacological behavior also only. So if non-pharmacological measures do a job, that could be relieved, because that could be due to the stress problems, due to anything. The next one, OSCE station, there may be some interactions in some medications they will give you, and there will be some clues in the initial statement. So you have to check your reference here in this kind of scenario, the leaflet, the SPC of the drugs, or the BNF, and then you have to guide the health professional about that medication, whether to switch to another medication, or stop the some medications. Like if there is a combination of medications like antibiotics and statins, so in this case the advice could be that if the duration of therapy for the antibiotics, you can stop the statins. That could be the rationale. So this kind of station will also be there. The next station will be about the confidentiality of a patient. For example, some family member of a patient can come to you and ask about the information about the patient. But as per laws, you cannot give any information of any adult patient to anyone, not even to the parents, without the consent of the patient. So in this scenario, you also have to follow the same pattern of the OSCE. Initially, the introduction statement, then the confidentiality statement, then you have to take the consent from anyone coming to the pharmacy. You have to ask few questions about the patient, and about the relation of the patient and the person coming to get the information. And after that, all the questions, you have to advise to that person about the solution. You cannot say abruptly that I cannot provide you any kind of information. You have to give advice properly. So you make them understand that it is by laws that I cannot give you any kind of information, but better you go back, you do talk, and you get some information from the patient directly. And at the end, you also have to give the statement like the follow-up. So follow all the steps in every type of OSCE. And there may be at the end a OSCE station, you have to give some guidance about the using of a medication, or like inhalers or anything else, eye drops, ear drops. There will be also this kind of station. So total seven OSCEs they will give you. So that's all about the verbal OSCE station. So anything if you want to ask, you can ask me.
We have a question saying, what are the best sources to practice from?
Do practice with anyone else by your own. You can check some videos from the YouTube. Like I shared the complete pattern. I had given you the 7 to 8 steps. You should write these steps, and then you should recall these steps verbally. You should practice. As much as you will do practice, you will be good in your performance. So reference source, there are book. PSI has mentioned a book, the Osce by Pharmaceutical Press. You can follow that book.
Is that the one you put up on the WhatsApp group?
Yeah, exactly.
Okay. So for
That's in
those
the list
watching
of
the
the PSI suggested reading books.
Yeah, so for those watching the video on YouTube later on, we have a WhatsApp group with all the pharmacists going through TCQR, and some materials are available to be downloaded there. So just reach out to me whichever way you want if you want to be added to that WhatsApp group. So from my experience, in anything that you practice in conditions that are very similar to the real thing. Like Bilal said, you should practice with someone else, because when it's a real person, it's different than if you're practicing all by yourself. Um, just do it in as real as possible, basically. So when you are practicing with another person, it actually makes it more real, and it makes you a bit nervous, and you have to get used to that, to those emotions, to being nervous. Now the next one is not really a question. It just says, I have appeared in OET and the same process I went through, although they only check your English competency, the scenario and process is same to convey message to the patient. So I think this is
Yeah,
what you were saying.
they want your understand. They want to get know the that how much you are familiar to get the understanding of the patient and how better you can give advice to the patient.
Yeah. So it's very important to understand everything that the patient says, and it's very important to be able to transmit your message to the patient in a clear way. Uh, I posted on the Facebook group a few days ago a label that was done by a technician with steroids, and it said to decrease to one tablet instead of decrease by one tablet. So a small word like that, 2 letters, can mean a big mistake in pharmacy. So
Yeah,
even during this OSCE, if you make a mistake such as this one, where you say by you say to instead of by, or something like that, and the message goes across in a wrong manner, it will not be good for you. So
for
just make
example,
sure.
there could be a scenario that there is an elder patient, and you are dispensing some strips of medications that have sharp edges and that do cause harm to the patient. So you have to do this kind of elderly angry patient also.
Oh, that's a bad combination, elderly and angry.
Angry, yeah.
Yeah.
So every kind of situation there could be there.
Yeah, they will try to put you in difficulty. They want to see how you are doing under pressure as well.
Yeah,
So it won't be all proper conditions and everything's nice. They will try to put you in difficulty to see how you would do in real practice. So yeah,
exactly.
yeah. So I don't have any more questions posted. Is there anything else you want to walk us through, or
Most of the information I already had provided. This is for the verbal OSCE stations only. For written OSCE stations, we will do another video next time.
perfect?
Yeah.
Okay. So I gather that basically you walked us through it all in great detail, which I thank you for. Um, any other small tips and tricks that you think? So between every session you have 15 to 20 minutes, is that right?
Yeah, 10 to 20 minutes.
And
So depends.
all seven sections are in one day, is it?
Yeah, all seven sections in one day in one sitting.
Okay, so so about 50 minutes would be the whole, because it's 7 times 7, right? Each session has 7 minutes.
Yeah, 7 minutes.
So you're gonna be talking for about 49 minutes, and
Yeah,
then 20 minutes in between them. Seven times, that's 140 minutes with 50. That's 119 minutes. So three hours and
oh,
10 minutes.
yeah,
The
exactly.
the whole thing takes about 3 hours,
Yeah,
over 3 hours.
yeah, exactly.
Ooh, you better eat before you do that.
Yeah,
Just don't go into it hungry,
yeah.
Um, yeah. Okay, let me see. Questions are coming in. Let's see. Since we are not familiar with the brand of medication, is it possible that we could just mention the active ingredients of the product as a recommendation in OSCE?
They will not give you the brands. There will be the generics only.
Okay, so perfect. Yeah, it would be expected that they do so. So basically, when you're advising the so-called patient, you're talking in generic names and active ingredient names, is it?
Yeah. Only the active name will be given, and not many medications. Few medications only will be there. There will
Okay.
be the patient history. If elderly patient, the complete patient history they will give you in initial statement. But some points will be there. Like if there is a penicillin, so patient have the penicillin allergy also. They will give this clue in initial statement. So if the allergy is a true allergy or some other type of allergy, this you have to ask from the patient that what happened when you previously taken this medication and what were the remedies at that time. So in final advice, you have to say patient that I am updating your record in your medical history that in future everyone knows before prescribing this medication to you.
In real practice, every time I dispense penicillin here, I leave a note on the bag for the over-the-counter staff to ask about penicillin allergies.
Yeah, exactly.
Because every now and then, maybe every 6 months or so, you will get a person saying, I am allergic to penicillin, and my doctor knows that, so I don't know why he prescribed me penicillin. So you kind of save a life, you save yourself a whole lot of trouble. And yes, in real practice, you have to make sure that if you know that some people might be allergic to penicillin, you have to ask everybody if they're allergic to penicillin, especially children
Yeah,
when
in
dispensing.
my exam, I get a scenario where they prescribed a penicillin, but the patient have the two penicillin allergy also. So they give the alternate medication name in the initial description also. So, but only we have to follow the pattern. So there was the information given already. They already tell us that the patient have the penicillin allergy, and alternate medication was also given in the reference source. So I started the OSCE station with the introduction, then confidentiality statement, then consent from the patient. Then I do 8 to 10 questions from the patient, and mainly focusing on the penicillin allergy, its symptoms, and what remedy he taken from he taken in past. So after getting all, I checked my reference. I just followed the step. I know the remedy at that time, but I have to follow the step. Do not miss the step if you already know the solution. But in it is an exam, you have to follow the step. So there you have to mention that you have to check your reference. So after checking the reference, you just have to switch the medication from one type to other type. This is the single word solution in this type of OSCE. But if you do it abruptly, you will get in trouble. You have to follow all the steps. Like another Oski, I want to share my experience that young lady was there, and she wants to get some advice about her constipation, and they mention in the initial statement that she has some kind of a stress. So this word that she is going through some kind of stress, I get to know that non-pharmacological behavior will be the treatment. So after starting from the eight initial steps, like same introduction, then confidentiality statement, then consent from the patient, then few questions like if any change in your recent days activities, if any change in your job, if you are going through the exams, you will get to know that there is something. Like when I was asking, she told me that she has switched her job, and due to that job she is unable to go to washroom on call, she is unable to do breakfast properly, so she is unable to do everything on time, and she is very much stressed because of a new job, and she want to perform. So after getting all the information here, no need to check the reference because there was no reference source initially in the PSI statement. So after getting all the information, so finally I have to advise that patient, and I advise her that the non-pharmacological behaviors. Here, no medication required. So non-pharmacological behaviors like to take dietary fibers, like you have to go to washroom on call. If you are not going on call, you may miss the day. And do some kind of exercise, take the dietary fibers. You can mention few names here, the dietary foods which contain the fibers. After that, you have to ask the patient if there is anything else you want to know. She may ask that I want to get some medication or not, then you have to reply her if she asks. Otherwise you can move to the next step, and finally again you have to say the follow-up words that if it is okay if I call you in couple of days just to check how are you moving with the things. So this was the OSCE which I faced in my exam.
Very helpful example. Perfect. Thank you for that. Now, it says, I'm a bit confused about adaptation period. If we can't find any pharmacist that there who is willing to take us, then what ways we should contact and find tutor pharmacist there? Yeah, it is the responsibility of the pharmacist. It will not be the PSI that will find a pharmacy for you. You can do it by yourself, or you can reach out to agencies like the one I own, the KamiqRecruitment. That's why I'm doing all these lives and all that to get you guys ready for when it's time to get you guys a job in a pharmacy in Ireland. So you can reach out to me when you're all set up and ready to go for the adaptation period, and I can find a pharmacy for you. It will be an advantage if you already have your English exam. So you should take into consideration that when you have to do a 6 months or 1 year adaptation period, if you have your English exam, it means that you will automatically be registered with the PSI after that adaptation period. And the pharmacy will look at that because they will take you in for the 6 months or 1 year, but their interest is to actually have you work with them as a pharmacist after you register, because it's a bit of a hassle for them as well to get like the pharmacist that is going to take you in has to do a course with the PSI in order to be able to be your tutor. So it's a bit of work on their side as well. And after they take you in, they actually have to look after you and show you stuff. So they would be willing to do that if you would be willing to stay and work with them after you become a pharmacist. So having your English exam reassures them that you actually will be able to work as a pharmacist. Because if you don't, the adaptation period will go by, and when it's time for you to become a registered pharmacist, they'll have to wait another 2 or 3 months, or maybe even more, for you to pass the English exam. And I'll tell you now that most 9 out of 10 do not pass their English exam on the first attempt. And out of those nine, 8 maybe won't pass it on the second attempt. You really have to work hard on your English to pass the English exam. Unless you're coming from a country where English is an official language, in which case you're off the hook because all you need is plain English, and you're recognized because you live in a country where English is the official language. But for the ones that are coming out from a country where English is not an official language, you need academic level English. I cannot stress this enough. Everybody stresses about everything else, but the hardest step to pass is the English exam. So once you have all that, it will be easier for me to find a pharmacy for you, because all the conditions will be met, and the pharmacy knows that after that adaptation period, they will have a pharmacist willing to work with them. So yeah, when you need a job, when you're ready to get your adaptation period, feel free to reach out, and I can help you find a pharmacy that is willing to take you in. Right now, because of the visa legislation, it's almost impossible, because there's a gap in the legislation. They will not give a visa for non-essential workers. So pharmacists are on the list for that. They get a visa because they're considered essential workers, but technicians are not on that list. So you cannot come and work as a technician with a visa, because you won't get a working visa. Now, the government is passing this from one to another. They will eventually solve it, but right now it's a bit of a no man's land when it comes to visa. So it's easier to get into the country by spouse visa or student visa or stuff like that. But a working visa for a pharmacist that is trying to work as a technician for a while is pretty much impossible to get right now. But we get reassurance that that will change soon. So as soon as I find out anything, I will post it everywhere for you guys to see it. You probably will find out before me, because I see you're very active, and everyone is very active in the WhatsApp group and in the Facebook group, and you're all you've developed into a great community, helping one another, and I am very happy to see that. Every time I see interaction between you guys and you're helping each other out, it makes life easier and more beautiful for everyone. So keep up the good work. But yeah, just want to reassure you, you can reach out, and I can help you find a pharmacy here.
Here I want to share one of my another Osce experience.
Yep, go ahead.
Yeah, I just remembered. There was a station that an elderly patient was there, taking nitroglycerin, diazepam, and few other medications were there for asthma also. And age was someone between 50s, so have to deal that station. There was mentioned that patient cannot go to his practitioner for 5 days, for next 5 days, as he is out of the station. So after following all the same pattern, every OSCE I'm repeating that you have to follow the same pattern: the introduction, the confidentiality statement, and taking consent from the patient about the questions. Then do start questioning, and I ask question about his present illness, its duration, its medical history, its medication history, and its allergic history, and its lifestyle history. So and about the present situation, that why he's unable to go to the hospital for next couple of days. So in this scenario, he told me that he is out of the station with his family for next few days and cannot visit his practitioner for next 5 days, for 4 days, sorry, 4 days. So he needs his medication supply for these days. So here I was little bit confused, because in legislations when I do study, it was mentioned that you can give emergency medication supply for 3 days. But I do remember that I learned from somewhere that you can give medication supply for up to 5 days also. So if there is a emergency. So after getting all the information and following all these steps, when there was the step of patient advice, I initially offered him that I am giving you for 3 days medication supply for these medicines. He said no, I need for more than 4 days, because I cannot go to see the GP before Sunday. The day was mentioned in the initial statement. So Sunday was the fourth day and Monday was the fifth day. So after his this statement, I realized, and at once I replied that okay, if it is the problem, I am giving you the 5 days supply, and you have to see your GP in next 5 days, most probably by Monday, and then you can get back to me for further supply. So this kind of scenario was also there, and follow all the steps, all from E to Z, to from introduction to the follow up.
Now, in real practice, every time I give emergency supply, it's 5 days. So I don't know. I never read the part with the 3 days, but you will surely be allowed to do a 5 day emergency supply. Sometimes you can even give 7 days emergency supply.
Okay.
During COVID, they let us do like even 30 days emergency supply or stuff like that. But uh, yeah, at least 5 days. Like 5 days would be very okay. If you feel the need, like if he says he can't see the doctor in 7 days, there will be no harm in giving 7 days emergency supply. But the standard would be about 5 days.
Mm.
So uh, you can easily give a 5 day emergency supply. You don't have to stress over it. Um, that's why they put that's why the OSCE said 4 days intentionally. So they wanted to see if you were strict about it or not, or if you have a situation where the patient asks for Ventolin or some other type of emergency medication, even though the patient has no history with you there, you are allowed to dispense it after you talk to the patient and use your professional judgment. Because there has been a case where, like long time ago, where someone had an asthma attack and the pharmacist didn't dispense the um, the inhaler because they didn't have a prescription, they didn't have a history with the pharmacy, and I don't know. I think the person died, or anyway, close to that. So for emergency medication, we are allowed to use our professional judgment, and we are allowed to dispense that medication if we consider that it is an emergency. There was another case where a young person allergic to peanuts was in a restaurant and they ate something that contained peanuts. They didn't know it was there. And the mother ran to a pharmacy and asked the pharmacist for an adrenaline pen. And the pharmacist didn't dispense it, and the young person died. And that there was a big media involvement and all that coverage, and there were some modifications to what can a pharmacist dispense and what can he not. So make sure that if you are presented when you start working in Ireland, if you are presented with this type of situation, make sure that you study the legislation. Like what we're doing here is not official advice. You have to study the legislation yourself and act upon it. Um, but you have to look into the legislation and see exactly what you are allowed and what you are not allowed to dispense, and it's better to do so before you're in that situation, uh, not not after. So
Yeah,
yeah, definitely look into the legislation. But regarding what you said there, the 5 days emergency supply is perfectly legal. You are allowed to do it, and you're actually allowed to do more than one emergency supply if your professional judgment says that the customer had a perfectly valid reason that they couldn't get through to the doctor in those 5 days. So just use your professional judgment. If they seem real, if they say, look, I couldn't do it because, and they give you a valid reason why they couldn't go to the doctor in those 5 days, you are allowed to give them another emergency supply.
yeah,
But
exactly.
I wouldn't abuse of that. Like usually we emphasize it that they have to go to their doctor within the 5 days. Yeah, but just so you know, you could do a second emergency supply.
Yeah, but when I was checking the past questions, there was a situation where a patient came to take the diazepam, but that patient, the pharmacist was not satisfied and he refused to dispense. So this could be in the your OSCE also. So for every type of situation, you should be ready.
Yeah, so I wouldn't dispense a second emergency supply of Anxical, you know.
Yeah,
So yeah, be careful. That's why I said use your professional judgment, and if it's medication that you would have any thoughts about it being misused or abused, uh, definitely like use your professional judgment and do not um, I mean, use your professional judgment and dispense or not dispense based upon the information that you collect. Uh, but yeah, I wouldn't do a second emergency supply of Anxicalm or medication that can cause addiction. So yeah, that's why every pharmacist has to use his own professional judgment.
yeah.
Perfect. Now there are no other questions from what I can gather. Um, if you want to add any tips and tricks at the end, anything that you think might be useful, anything that you remember from your own experience, now is the time to do so.
As per my understanding, I think I had shared all the necessary information. The one trick only I want to give is to do practice. You cannot read OSCE, you cannot go by books. You have to do practice only for verbal OSCE. For written OSCE, you have to study. For written OSCE, like I get to OSCEs, those were from the hospital setups. Like you have to change from the oral dose of opioids to the IV dose, or from IV dose to the oral dose. My station was to change the IV dose to oral dose, and the other station was you have to monitor the warfarin levels, and there were some questions about the warfarin. So that we will discuss in another video, inshallah.
Keep it, keep watching.
Yeah, keep
Yeah,
watching.
we will do as many videos as needed. I saw the need for this video. I saw it in the WhatsApp group. People started asking questions about the the ASCII, so I thought maybe a small chat would be welcome and would be of use to you guys. Um, we will wrap it up here, and like Bilal said, we might do another video about the written part of it. Is it?
Yeah, written OSCE stations. Two written OSCE stations are there in exam.
And is that all? You have the 7 verbal ones and you have the 2 written ones?
Yeah, exactly.
Okay, so that this OSCE exam, is this before the other exams? How many exams are there altogether?
That's initially the one is the document evaluation stage, stage one. The stage two is equivalence examination, and equivalence examination have three parts: the MCQ multiple choice questions, 80 multiple choice questions day one. So, and after that, two written OSCE stations. In one written OSCE stations, you will get four questions or three questions or five questions, but same 7 minutes only. There will be reference source like SPC of the medication or the hospital guideline chart will be provided to you. Question will be short, answer will be short, but you have to find the answer in the reference source, and then you have to put the answer in the given space. 7 minutes only. So written OSCE station is more complex than the verbal OSCE station. And
Okay.
after the written OSCE station, the seven verbal OSCE stations. So these three parts, the multiple choice questions, two written OSCE stations, and seven verbal OSCE stations are equivalence exam. Then the adaptation stage, and then the final registration exam, which is only OSCE based.
Okay. So the 80 written ones are how many days do you have in between these?
No, the first day is the written multiple choice questions, and after multiple choice questions, there is short break and the written OSCE stations.
All in the same day.
Now all the same day, and the next day is verbal OSCE station.
So the first day actually takes a lot of time out of you. Like it.
Yeah,
Eesh. Wow. So that's all the exams. That's all they have. Anyone has to go through, right?
yeah, that's the all the exams.
And everything now can be done online. All this for this in the past, people had to come to Ireland and do it physically here, but now it's all done
No,
online.
everything is online virtually through Canvas.
Perfect. Okay, that's a lot.
Yeah,
Okay, so we will be covering those in a separate video then.
yeah.
Um, Perfect. Thank you, guys. We have a lot of thank you here just to see that people appreciated what you do. So they are thanking you, Bilal. I'm thanking you.
One thing I
Um,
want to add more. Mostly, people think that they will do OSCE very well. It is only that you have to speak, so they do not do practice. But that's the thing you have to worry about, because if you will do a practice with someone else, a simulated patient, then you will get realize that how many mistakes you are making. Initially I was thinking this also, but when I did practice, then I realized that I am very much behind. I have to do practice as much as on daily basis on every OSCE topics. So I decided to go by one or two topics every day. So practice for a month or more than month for OSCE station. Then you can perform in the examination, because they will evaluate all these three parts statistically. So if you are performing well, then your adaptation will be decreased. So if you are not performing well, you may get the adaptation for up to 3 years. Or if performance is very bad, you may be refused to get into the next stages.
and say someone gets nervous and doesn't say a word, like they they get nervous and they don't perform. They perform poorly. If they get rejected, do you have any idea when they can apply again
Yeah, you have to apply again from the stage one.
and pay the fifteen
Yeah,
hundred euro?
again pay this for one sitting. You have to pay separately.
Oh yeah, and one of the questions I got yesterday, this is all covered under the 1,500 euro that you pay
Yeah, from
when you get
stage
started.
one to the last stage, stage four, single fees the 1500 euro.
Could you walk me just simply through stage one, stage two, stage three, and four?
Yeah,
Just
sure.
yeah. So
The
what does
stage
stage one mean?
The stage one is the document evaluation form. You have to submit the application form along with your transcripts and the syllabus from your universities directly to the PSI. They will take 4 to 5 months for the document evaluation, and then they will email you that you are being evaluated, and you can sit in the equivalence examination, and we will give you the date in next email. So prior to the examination, 3 months prior to the examination, they will give you the date of the exam and will send you a application form to sit in the examination. You have to fill that form and send back to the PSI as early as possible, because there is a fixed number of seats. So first come first serve basis, they will allot you the seats in the next sitting of the examination. If you get not allocated in that sitting, then you will automatically get allocated in the next one.
Do
So,
you have any idea how many seats are available?
when I was taking the exam, there were 35 to 36.
There are over 500 in my Facebook group. Okay. All right. Uh, okay, keep going. Just so
So,
you guys would be ready, just to see
yes,
exactly what level of
this,
competition.
this after the document evaluation, then the stage two, you have to sit in the examination, the equivalence examination. You will sit for the exam for 2 days, the first written one and then the second verbal one. So after the exam, there will be another form, the portfolio form, which you have to send to PSI by filling with your all the experience history and your continuous professional development certifications to the PSI. They will give you a deadline. That deadline will be after some days of your equivalency exam. So that's the stage two. And after stage two, the next is stage three, which is the adaptation period, and last is stage 4, which is the professional registration examination, and after that's the IELTS and the registration.
And how much time passes from stage 1 to stage 4, would you say?
It depends, like this year people are suffering, but in my time I did applied in February, and I got my examination done in November and got result February this year. So 1 year it took from document submission evaluation to the result of equivalency stage.
Okay, and 1 year with 6 months adaptation period, say it's a would be a minimum of a year and a half before a pharmacist would be registered with the PSI.
Yeah, exactly. So mostly, as much I know, mostly people getting the adaptation around 1.5 year.
Yeah,
Yeah.
maybe even
So
more.
maybe more, maybe more.
You
There
could
is
get an
one I think
adaptation period of
that
1 year.
get 2 years of adaptation.
Yeah, yeah. So just for those of you, I get a lot of pharmacists reaching out to me. They don't look up on the PSI website. They just reach out directly. Oh, I want a job in Ireland, and I have to spend half an hour convincing them that you actually have to go through a long process of a year and a half before you can practice here. Um, so I hope watching this video kind of sheds some light of the steps that you need to do to actually register as a pharmacist here. So
Yeah.
it's not easy, but if it was easy, everyone would do it. So
Yeah.
do the hard stuff, and you will reap the hard reward. Perfect. Listen, Bilal, thank you, thank you, thank you for your help. Thank you for actually offering yourself to do it. It's
Thank you so much for giving me the chance. That's an
yeah.
honor for me to sit with you.
Thank you. It's an honor for me to sit with you as well. So whenever I see people that want to contribute and help others, uh, it it makes me happy. It shows us that together we are stronger. And what remember that whatever you put out there, God has takes care for you to come to get back.
Yeah, exactly.
So do not expect to reap rewards, because I have seen a lot of people complaining that nobody's helping you these days, nobody's reaching out, nobody helps each other, but they themselves do not help other people. I
You
see a
know,
lot of people that
people
want.
do complaints, but they do not ask questions. You have to ask questions. If you are not asking, you are only asking the questions about the time duration, about the steps, that how we can go with shortcuts. You cannot go with shortcuts. You have to follow all the steps.
Exactly.
It's same like the ASCII. You have to follow the all the steps.
Yeah, perfect. All right, we will wrap it up here. Thank you very much, Bilal, and I will see you in another video. Uh, yep, you guys have a great day, and thank you for joining us. And all of you watching the recording, have a great day as well. Bye bye.